think the way that I've tried to enhance the experience has been through my additional education and also the technology that I've adopted or adapted to and adopted in the practice. And what I mean by that is if I look at something that comes out, I always look at it and say, is it going to make it easier on the patient? Is it going to make it more predictable for the patient? Is it going to reduce anxiety for the patient? And if it's going to do all those things and it's something that makes my job easier or makes my assistant's life easier, then it's something I really considered. And so that's where the lasers came into play. We can get away with less anesthesia, which means less needles, less shots, which nobody really wants to have those in the first place. I can do a lot of procedures with the laser. And then as we advanced on, we have things for constructing crowns in the same day. And so I have in-house lab that we can produce crowns, we can produce dentures, we can do all-on-X treatments. I took it a step further with dental robotics and the Yomi robot from Neosis. And you say the word robot and half the people love it and half the people are scared of it, but it's not a robot that's placing the implant. It's basically, I do the entire planning on a CT scan, which is another piece of equipment that makes my life easier and allows for better diagnosis and more precise implant placement. But with the robot, I plan the entire surgery out digitally with digital templates into the CT scan. And the robot simply helps me to execute the surgery, to execute the plan. And it's incredible how precise it is. For example, if I'm placing a 12 millimeter implant and I place the drill at the proper angle, and once the robot lines up, it will only let me go to 12 and only at that angle. If I try to push down past 13 or past 12 to 13, it won't allow that. So the robot's basically playing defense. And that's really important when we're trying to avoid a sinus or avoid some type of vasculature, whether that's a major artery or vein or something like that we're trying to avoid, or the walls or the nasal floor, different things like that the robot allows me to be minimally invasive and really be very accurate to engage the best bone that I possibly can. So all of those things combined bring together my education and my training, but ultimately those things are not just because I like having fancy toys in the office, it's because the end result is it's going to be a better outcome for the patient.